This exercise is repeated extension in lying for the lumbar spine. Patient position. Patient is going to start standing over a firm surface. They're going to go to the ground, maintaining the lordosis, meaning the arch in the low part of your back. Patient is going to do this by wide stance in a lunge position, dropping down into an all-four position, maintaining the arch in your back, letting hips drop, and then lying down flat. Patient is going to monitor symptom location and intensity prior to beginning the exercise. To progress into this exercise, it is commonly instructed the patient will pop up onto their elbows. In this position, they're going to monitor the location and intensity of the symptoms. This, if instructed, is commonly instructed for 1 to 3 minutes to assess response. Patient will then drop back down onto their stomach. Based on instruction, the patient will perform now repeated extension in lying, meaning that everything from the hip down is going to relax. The patient is going to bring their chest up with their arms at shoulder level, then back down. We're performing 10 to 15 repetitions, each time going further and further into the available range. Patient is going to monitor the symptom location intensity. If symptoms are traveling further down the leg or intensifying further down the leg and remain worse when patient stops and returns to the prone position on their stomach, patient should stop and contact physical therapist. If it gets easier to do and symptoms move from the ankle, knee, calf, hip, toward the back and remain in the back, or the exercise gets easier and easier to do in your range of motion, patient is to continue as this is a desired response. As patient gets to the 10th, 11th, 12th, 13th, and 14th, 15th repetition, patient should be aiming to extend their elbows to be completely straight, if possible. Again, relaxing everything from the hip down. As a progression of force, if instructed, patient is to, at the end of the available range of motion, holding for 1 to 2 seconds, breathe out, relaxing your hips as they sag down. If this decreases your pain while in this position, this can be instructed to remain in this position for up to 5 to 10 seconds. Typically, as instructed, patient will perform the exercise 10 to 15 times, loosening up the first 1 to 2 repetitions, and then breathing out at the top, holding for 1 to 2 seconds, then returning back down to baseline. Each time patient is visualizing and thinking, they're going further and further into the range of motion.